And actor Eric Dane, known for his roles on Grey's Anatomy and Euphoria, revealed earlier this week that he's been diagnosed with ALS, also known as Lou Gehrig's disease. It is a devastating diagnosis with no known cure. Our David Chudowsky is in Studio B this morning with a guest who can give us more details about it. Good morning, Dave.
Yeah, good morning, Danita. We know this rare disease affects about 30,000 people in the U.S. right now, and this morning we're taking a closer look at what ALS is, what signs to watch for, and the quality of life treatment options. And that's why we're bringing in Dr. John Morren from the Cleveland Clinic this morning. Thanks so much for being in here.
My pleasure.
Yeah, I know it's early, so we appreciate you taking the time for a very, very important topic. And first of all, what exactly does ALS do to the body?
Well, ALS is also known as motor neuron disease, and I think that descriptor is helpful in understanding what it does. So we have the ability to move by muscles contracting and causing that effect, but that's a downstream outcome of motor nerves, which start in the brain, connect through the spinal cord, and then to the muscles through peripheral nerves, and we expect them to work. In this condition, they stop working, they start dying off. So interestingly enough, it causes progressive weakness, and you can have weakness in the limbs, or you can even have weakness in muscles of the head, face, neck area, so speech, saliva control, chewing, swallowing, or even breathing could be affected.
Just terrible, absolutely. Now, I mentioned that it's rare, but maybe not as rare as it used to be?
Well, and there are data that support that this might be increasing in its incidence and prevalence, and every 90 minutes there's a new diagnosis of ALS and somebody who passes away from ALS.
Yeah, that's staggering for sure. What are the early symptoms that you can see with this?
And part of why this is difficult to diagnose, diagnostic delay is usually a year or more, unfortunately, is because it could start up in many different ways. So the weakness may start in the leg. Maybe the patient starts saying, my foot is slapping and I have to lift it higher, or I'm getting clumsy in my hand, or it may start with, I'm having slurred speech, or I'm drooling. So it could start with any one of those or combination of symptoms, and it may progress in a combination of ways as well. So there's no real standard way it would start up and progress, but it may have any or all of those elements, but it is progressive. And importantly, there's no pain or no numbness, tingling, or other sensory symptoms.
Perhaps people don't exactly know when to go see a doctor.
That's part of it.
Yeah.
Well, they know something is wrong and they go to see a doctor, and unfortunately, because this is rare, the doctors can't see the red flags and direct the patient to the most kind of effective and efficient workup. I must mention muscle twitching is another feature often seen in ALS, but muscle twitching can occur in multiple other benign or non-terminal conditions. So often patients may search on the internet muscle twitching, and they'll see this diagnosis. And quite often I see a lot of patients who have something else, but they're worried about it because of the internet search.
Dr. Google, yes.
Yes.
Yeah. So if you do decide that you feel you have this or you have the symptoms, right, what specialist or what doctor should you see?
It's a very good question, and we've studied this. It is important that you see a neurologist, and if you have access to a neuromuscular specialist, that will cut down the delay to this diagnosis significantly, because it requires somebody who has the expertise in understanding the right history questions to elicit and the examination signs to elicit, so they need to know what to look for, and also how to work you up. And quite often it involves a specialized test of the nerves and muscle called electrodiagnostic testing, or EMG.
Let's talk more about how can someone manage this?
So, true, there's no cure,
right?
But I often tell patients no cure doesn't mean no care. There are 2 FDA drugs that work to improve survival truly only in the order of months, maybe a year or so, but treating symptoms, we have a number of ways we could do so, including medications, and it really becomes not increasing quantity of life as much as quality of life, and we could do that.
Is there anything that gives you hope or should give us hope about a cure in the future, or anything that's happening right now that we could feel somewhat positive about?
I would say, in 2014, we had the ice bucket challenge. Everybody,
yes.
that was really a big social media blitz, and that generated about $200 million.
Wow.
That was largely channeled into ALS research. I know ALS, I know AI is a very big buzzword right now, and we are seeing application of AI in drug development causing significant benefits. So drug development that would usually last about 10 years before a new agent is on the market, that time to development is cut by 1/10, so maybe less than a year instead of 10 plus years. And cost is being driven down by about 70%. So we're hopeful that with various avenues that are showing promise with new drugs, the application of AI technologies would be able to expedite the next drug that will make a much bigger difference.
Yeah. All right. Well, that's a lot of information, and definitely information we can use, and hopefully there will be a cure in the future for this. Dr. John Morren from the Cleveland Clinic, thank you so much for being here this morning on WKYC Plus.
Thanks for having me.
Danita, we're going to send it on back to you.
All right, Dave, definitely learned a lot about this disease that I didn't know from that interview. Good information. Thank you.